Right now, wherever you're sitting, your lower spine is under load. Not dramatic load, not the kind that announces itself with a snap or a tear. A quiet, constant, almost invisible load that has been building since the moment you sat down. And it will keep building long after this video ends. This is the part nobody explains to you about lower back pain. It is not usually an event. It is an accumulation. Here is the number that should unsettle you a little. When you stand upright, your lumbar discs are already carrying a meaningful share of your body weight, distributed through 5 stacked cushions of cartilage and fluid between your vertebrae. The moment you bend forward, even slightly, the pressure inside those discs does not rise gently. It spikes. Research on spinal loading shows that simply bending forward can raise the internal pressure in your lumbar discs by somewhere between 40 and 100%. And if you're holding weight while you do it, that number climbs even further. Your spine was not built to treat forward bending as a neutral position. It was built to treat it as a controlled emergency, briefly tolerated, not sustained. Now think about what a desk job actually asks of your body. It asks you to hold something close to that same forward-leaning, flexed position, not for a few seconds while you pick something up, but for hours at a time, day after day, year after year. Your spine has no evolutionary memory of this. For most of human history, the body moved between positions constantly, standing, walking, crouching, reaching. Sustained flexion for 8 hours was never part of the design brief. And here is the detail that makes this worse than simple discomfort. Your intervertebral discs have no direct blood supply. They are a vascular tissue, meaning they cannot receive oxygen and nutrients the way muscle does, through a network of blood vessels. Instead, they rely on something closer to a sponge mechanism, absorbing and releasing fluid through pressure changes as you move. When you sit still for hours, that pump stops working. The disc is not just under load. It is being slowly starved of the nutrient exchange it needs to repair itself at exactly the moment it's under the most mechanical stress. This is why so many people describe their back pain the same confusing way. It wasn't there in the morning. It built through the day, and by evening, it feels like something has quietly gone wrong, even though they can't point to a single moment it happened. What's actually happening is 2 processes stacking on top of each other. Mechanical pressure is compressing the front of each disc, and metabolic starvation is reducing the tissue's ability to withstand that pressure. Neither one alone would necessarily cause pain. Together, sustained for years, they set the stage for the structural failures we're about to walk through. There's a second, quieter mechanism working against you at the same time, and it has nothing to do with discs directly. It's your hip flexors, specifically a muscle called the psoas, which connects your lumbar spine to your femur. When you sit for extended periods, this muscle shortens and tightens, adapting to the position it's held in most. A tight psoas does something specific to your lower back. It increases the natural curve of your lumbar spine, called lordosis, pulling your pelvis and spine into an exaggerated arch even when you're standing. That altered curve changes how force travels through your spine, placing additional strain on the small joints at the back of each vertebra, called the facet joints. So the very muscle that's supposed to help stabilize your hip while sitting is quietly reshaping your spine's architecture for every position that follows. Put these 2 mechanisms together, disc starvation from stillness and structural distortion from a tightening hip flexor, and you start to see why lower back pain so rarely has one clean cause. It's not the desk. It's not bad posture in isolation. It's not one heavy box you lifted wrong. It's the compounding interaction of pressure, chemistry, and muscle adaptation, all happening below your conscious awareness for years before the first sharp signal ever reaches your brain. So what actually happens when that accumulated stress finally crosses a threshold? To understand that, you need to look inside the disc itself. Each intervertebral disc has 2 parts: a tough, fibrous outer ring called the annulus fibrosus, and a soft, gel-like center called the nucleus pulposus. In a young, healthy spine, that center is rich in water-attracting molecules called proteoglycans, which keep the disc plump, hydrated, and able to absorb shock. But starting in a person's 20s, sometimes earlier, That hydration begins a slow decline. The nucleus loses water content, becomes less flexible, and the outer ring that contains it begins to accumulate small tears from decades of repetitive loading. This is where the mechanical story and the aging story converge. A disc that's already dehydrated and structurally weakened is far less able to withstand the repeated pressure spikes from forward bending and prolonged sitting that we just described. Under enough combined stress, the soft center can push against that weakened outer ring, causing it to bulge outward. In more severe cases, the material can push entirely through a tear in the ring. This is what's clinically called a herniated disc, sometimes described by patients as a slipped or ruptured disc, though nothing has technically slipped out of place. It has pushed through a structural failure point that took years to develop. Here is the detail that explains why herniated discs hurt so specifically and so severely. It's not just mechanical compression. When disc material pushes into the spinal canal, it doesn't just physically press against nearby nerve roots, it also releases chemical irritants that trigger an inflammatory response around the nerve. So, you're dealing with two separate assaults on the same nerve at once, direct compression and chemical inflammation, which is why the resulting pain often doesn't stay in the back at all. It travels. This is the mechanism behind sciatica. The sharp, shooting pain that runs from the lower back through the buttock and down the back of one leg, sometimes reaching all the way to the foot, accompanied by numbness, tingling, or noticeable weakness. There's a related but distinct failure mode worth understanding too. Spinal stenosis. As discs degenerate and lose height over years, the space they once occupied narrows, and surrounding ligaments can thicken in response, a process called hypertrophy. Combined with arthritic changes in the facet joints we mentioned earlier, this progressively narrows the spinal canal itself, physically crowding the nerve tissue running through it. Unlike a single acute herniation, stenosis tends to build gradually, which is exactly why it's one of the leading causes of lower back pain and functional limitation worldwide, affecting well over 100 million people, most of whom experienced years of silent, subthreshold change before symptoms ever appeared. It's worth naming the rare but genuinely urgent version of this mechanism because it matters. In extremely rare cases, severe compression of the nerve bundle at the base of the spine can cause loss of bladder or bowel control, a condition called cauda equina syndrome. This is not something to monitor or wait out. It is a medical emergency requiring immediate attention, and it's the one scenario in this entire story where the correct response isn't stretching or rest, it's a hospital. For the overwhelming majority of people, though, back pain never reaches that threshold. It lives instead in this middle zone. Disc degeneration slowly progressing. Mechanical stress from posture and stillness compounding it, and a body that's been quietly compensating for changes it never asked you to consciously manage. Here's where the story becomes almost paradoxical. And it's the piece that finally explains why so many people with lower back pain feel like their body is working against them. When your spine detects instability, whether from a degenerating disc, a tightened psoas, or altered load distribution, your nervous system doesn't shrug it off. It compensates, aggressively. Studies of people with chronic lower back pain consistently show higher activation of the trunk muscles surrounding the spine, both during standing stillness and during movement, compared to people without pain. Your body is essentially bracing constantly, trying to manually stabilize a joint system it no longer fully trusts. That sounds protective, and in the short term, it is. But sustained over months and years, this compensatory bracing becomes its own problem. Higher, near-constant muscle activation means higher, near-constant spinal loading, the exact mechanical stress that damaged the disc in the first place. The body's own protective response starts feeding the underlying injury. Researchers studying this transition describe it as a shift from acute low back pain into chronic, disabling low back pain, driven not by a single new injury, but by this self-reinforcing loop of instability, compensation, and increased load. So what actually interrupts this loop? Not magnets, not passive heat, not waiting it out in stillness, since stillness is part of what created the problem in the first place. The disc's fluid exchange mechanism, the sponge-like pump that brings in nutrients and clears waste, depends on movement to function at all. Regular position changes throughout the day. Deliberate hip flexor stretching to reduce that excess lumbar curve, and controlled strengthening of the muscles supporting the spine all address different links in this same chain: mechanical pressure, chemical starvation, and compensatory overactivation. None of it reverses years of disc change overnight, but all of it interrupts the loop that turns manageable degeneration into disabling pain. And if numbness, shooting leg pain, or any change in bladder or bowel control ever enters the picture, that is the signal to stop reading and go see a doctor immediately, not tomorrow. What this really tells us is that your spine was never failing you suddenly. It was sending signals for years, in fluid exchange rates, in muscle bracing patterns, in tiny structural tears, long before pain ever reached your conscious attention. The ache you feel today is not the beginning of the story. It's the moment the story finally got loud enough to hear. So think about how you sat down to watch this video. Was your spine flexed forward the whole time? Tell us in the comments what your daily posture actually looks like, and if this changed how you think about your next 8 hours at a desk, you know what to do. See you in the next one.